I'd like to introduce Nathan Lampenfeld. And Nathan, you can tell us a little bit about yourself and what you and Gabby are going to be discussing this morning.
Sure. Yeah. So I'm a William and Hannah Penn Fellow at the Department of Aging. Basically, that's a 2-year policy fellowship. I was part of the Aging Our Way PA team, leading the content development and working with Gabby and our other colleague, Jesse Pierce. But we'll be talking about, Gabby will be introducing Aging Our Way, doing some of the overview, and then I'll be discussing the PA Care Kit, which is a new product of Aging Our Way. It's our Caregiver Toolkit. So we'll talk about some of the details there and how we're helping to raise awareness of the product.
Absolutely. And hi, everybody. My name's Gabrielle Samanthi. I'm the Special Advisor to the Secretary here at the Department of Aging. A little bit of background about how we got connected. I actually had met Heather out in Pittsburgh almost over a year ago now at a meeting with myself and the Secretary and Heather, and got to see a lot of the great work going on in the western part of the state. And we're invited here today to talk about a little bit of the overview of, like, as Nathan said, of Aging Our Way PA, Pennsylvania's 10-year multi-sector plan. And then he's going to get into the specifics on the PA Care Kit, which is a really, really exciting brand new initiative of the department that was just finalized and released last week. So excited to be here, and thank you for having us. I'm just going to talk a little bit about the Aging Our Way background, kind of how it came about, the development, where we are now, and looking down the road, looking forward. So in 2023, we had a new governor come in. Governor Shapiro came in and actually signed an executive order in instructing the Department of Aging to undertake a multi-sector plan. So this multi-sector plan looks at everything beyond just what we normally think of when we think about aging services. So this was really supposed to be a comprehensive, broad plan that brought in stakeholder engagement, that talked to the other agencies, that looked at aging from a broader lens than we normally do. And this was because really the older adult demographics are changing in Pennsylvania. Right now, about 1 in 4 of every Pennsylvanian is over the age of 60, and that is expected to grow to be about 1 in 3 in just a few short years now. By 2030, about 33% of Pennsylvania will be over the age of 60. And this provides a really great opportunity for the Department of Aging and for the Commonwealth to get ready to be able to provide the necessary services for these older adults, and also to invest in this demographic because they provide so much back to the Commonwealth. Additionally, multi-sector plans for aging are a national movement. You know, there's a lot of other states that were doing this at the same time. Pennsylvania, I'm proud to say, did it the fastest. You know, we weren't first, but we were definitely the fastest in building this and had the most stakeholder engagement. We had over 20,000 Pennsylvanians contribute input to the plan. We did this through over 200 listening sessions with one in every single county. You know, we partnered with the University of Pittsburgh School of Public Health to do a needs assessment survey. That was really that quantitative effort that matched our qualitative effort across the state with the survey. And then we also had over 30 state agencies that contributed input to this plan and are committed to the plan. You know, I'm constantly talking to people that we normally wouldn't interact with, people at the Department of Conservation and Natural Resources, the Department of Community and Economic Development, these different areas where we normally don't think about aging services, but that definitely work with older adults. You know, one agency that I like to talk about a lot is the Department of Transportation. Transportation is such a critical service for all Pennsylvanians and especially for older adults. And so that's, you know, an agency where we haven't had a lot of collaboration, a lot of partnership within the past. But now, you know, we're constantly talking to our partners over there and making sure we're providing the services that are necessary for our 60 plus population. So those 30 state agencies are really integral in in this plan. And we do have the amount of days from executive order to publication, which is just over a year from the day that the executive order was signed to the day that we were releasing the plan publicly and getting it signed by the governor, which was just about a year ago now. You know, after all the stakeholder engagement and all of the background research we did, it resulted in Aging Our Way PA, a 10-year roadmap to aging transformation. And we have 5 high-level priorities, 36 strategic approaches, and 163 actionable tactics. Those 5 priorities include unlocking access, aging in community, gateways to independence, caregiver support, and education and navigation. So these are the priorities that really came out of all of those listening sessions, all of the comments that we received, the data that we got back from the University of Pittsburgh. Today, we're really going to be focusing on caregiver support. This was highlighted as like a number one need by both the people that we heard from and our legislative partners. So in our budget last year, the Pennsylvania legislature indicated that we needed to focus our efforts on caregiver support to provide support, training, respite, navigation tools to paid and unpaid caregivers. And so that really resulted in our focus being on the caregiver toolkit, which is now known as the PA Care Kit that Nathan has been working on for about a year now. And that I can turn over to him, I think, at this point.
Yep. So tactic number 128 was for us to design a comprehensive caregiver toolkit. Like Gabby said, it was under our priority for caregiver supports, organized for supporting caregivers and care partners. So we're really focusing on that unpaid informal caregiver that really do take the brunt of care work that we rely on as a aging services network. And that provides so much important holistic care for older adults. So we call it the PA Care Kit now. I like to highlight this quote from Rosalind Carter because there are so many caregivers out there. There are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So the PA Care Kit, the collection of tools, information, and support. It supports caregivers through key challenges in the caregiving journey. It's personal, practical, and ready for all kinds of caregivers. And we're making options available both digital and in print. That's our sort of high level, a quick elevator pitch. But today I'm going to talk about sort of the development process, some of the input that went into the actual creation of the care kit, and then I'll do a demonstration of the care kit and some info on what the next steps are. So it's actually been 9 months. I think we did that more quickly than a year, quicker than any other toolkit that we've seen. But it started in August of 2024 with our first phase of the project launch and visioning. So we were trying to take that single tactic statement and develop a more comprehensive plan and vision for what we were trying to build and what we were trying to create with this caregiver toolkit. We spoke with our agency partners, we spoke with caregivers, we spoke with older adults, and then we also did a survey of existing toolkits. Those are from other states, from other organizations, but we were really doing a scan to understand what we liked, what we didn't like, and what we didn't see but wanted to include in our care kit. Then we moved on to actually developing the content and reviewing it, sort of a back and forth iterative process with our stakeholders to make sure we weren't missing any subjects. We were including everything that a caregiver would need, and making sure that the actual way that we articulated this information was appropriate, accurate, and delivered in a way that would help caregivers learn and retain the information. We also, the care kit is housed on the pa.gov website. So we worked to build some additional mechanisms into that platform that we wanted to see with the care kit. And I'll touch on that a bit later. And then finally, the marketing and media campaign. We're in the middle of development process and the rollout, but basically we have two approaches to how we're trying to raise awareness of this care kit. It's our grassroots word of mouth approach, and then this formal marketing and media campaign. And I'll discuss some of the messaging that we're anchoring in our central brand as well. So as I mentioned, we were engaging stakeholders, our caregivers as well. So we had a survey with nearly 250 responses, almost 90% of which were family and friend caregivers. That population we were really trying to target. And we created 5 key themes. These themes aren't surprising if you're a caregiver. These are things you should be very familiar with. But we were building on that 20,000 points of engagement from 80 Year Away and trying to really sharpen what the challenges and challenges caregivers were facing, what the expectations they were interested in for the care kit. So just to summarize these themes, there's a low awareness of resources. So the start of caregiving is associated with a very steep learning curve. People aren't aware of what entitlements, benefits, and programs they might be eligible for, and they don't know all the acronyms and jargon that's associated with the federal, state, and local programs. We know that, more effective communication and widespread awareness of caregivers is really important to make sure they have access to the resources that are available to them. We know caregivers are under a high level of stress, that caregiving is a complicated journey. It reshapes our relationships with the person we're caring for, with our friends, family, and neighbors, as well as with ourselves. Caregiving is often too difficult for one person to handle. It's really important for caregivers to build that support network, and doing it as early as possible in the journey helps prevent that caregiver burden and create caregiver burnout. We know that caregivers have unrealistic expectations and they face progressive challenges in their caregiving journey. So the start of caregiving can feel overwhelming, but seasoned caregivers told us that once they found those resources, tools, and support, the journey became much more manageable. Caregivers feel unprepared for the decline of the person they're caring for, so they don't really know what they're getting into when they start caregiving. There are severe financial challenges with caregiving. That's high costs, limited financial support, and especially insufficient assistance for those middle income families. Those are folks who aren't necessarily eligible for more supportive programs, but cannot reasonably pay for the cost of care out of pocket. That financial strain makes caregivers feel overwhelmed. It's that financial strain is unexpected. And again, it really affects those middle income folks. We know that caregivers need a more proactive education and guidance in navigating the different resources, because that caregiving journey is so evolving, it's so unpredictable. And when people are new to the role, they don't know what to expect. So navigation challenges, again, people have a lack, there's a critical gap in understanding of accessible and reliable resources, and actually, activating those different resources. So caregivers, because of that, feel overwhelmed and unsupported. Caregivers face significant challenges due to the lack of communication, coordination, and information sharing between our health systems and our social systems. So our doctors, our hospitals, not communicating with the community organizations that are providing that care in the home and in the community. And navigation, again, it leaves caregivers overwhelmed, financially strained, and emotionally isolated. Things that lead to that caregiver burnout. And many caregivers express a frustration with automated systems, those phone trees where they would prefer to talk to a real person, or navigating online resources where they have to go through 100 different websites to get all of the information that they need. Caregivers often, in that survey, provided a lot of considerations for support options that bubble to the top. I'm not going to go over all these because they, influence the care kit in a lot of ways, and that's the topics and the things that we use to guide the development. We came up with these 6 key design elements based on all of that data. So visible and convenient. We know caregivers are pressed for time and may not have the ability or resources to search for information on multiple websites. Keeping 1,000 tabs, it's what we've strived with the care kit is to have this one-stop shop, a one-stop shop that's easily findable and visible when you're, it's 1 a.m. and you have to do a new care task tomorrow that you're not ready for. And realistic and encouraging. So we're trying to focus the tone and the way that we're using the language in the toolkit to be more empowering. We know that caregiving can be isolating, that many caregivers experience guilt, confusion, and stress. We want to offer realistic expectations of what caregiving is. So not that doom and gloom picture of caregiving is a huge burden and it's overwhelming, but not that sugar-coated picture of, it's a wonderful experience. It's probably something more in the middle. So we're trying to, reframe our language and make sure it's appropriate. Clear and practical. So caregivers often struggle with those complicated and unclear instructions. We strive to make sure that the instructions and language on the care kit are readable, that they're directly translatable to our care tasks. Up to date and accurate. We know that the toolkit must be consistently updated to make sure that caregivers are provided with the most current information on the different services, costs, and care options, but also so that, the links that we include in the care kit aren't broken and that they're leading to information that they need if we're referring people further. And then comprehensive and inclusive. The toolkit needs to address the diverse needs of all kinds of different caregivers, acknowledging that there's unique challenges that come with the different caregiving stages and situations. So we want this toolkit to be for everyone. So we've created vast, comprehensive information that should be for everyone. And then targeted and proactive. Again, it really reiterates our need to raise awareness of the care kit. It's essential to support caregivers early in their caregiving journey. The earlier, the better. And that may be even before they call themselves caregivers. So we're trying to reach people in the community that are doing these care tasks and could benefit from the help. All right, I'm going to switch over to the demo here once I move all these screens. All right. So we, like I mentioned, we've housed the PA Care Kit on our PA.gov, the Commonwealth's web presence, and that gives us a few advantages. So number one, it makes the Care Kit more search engine optimized. So if someone is searching from Pennsylvania, they'll be more readily available to find the Care Kit. It's has a bigger web presence than if we had it on a separate website. It also helps with our connectivity to other state programs and to searching on the PA.gov website. So if I'm on the PennDOT's website looking at senior transportation, I'm more readily connected to the Care Kit. And then it also makes the webpage fully translated. So if I'm searching from my phone that's in Spanish or some operating system that's already, the settings are set to Spanish, the page will automatically translate to Spanish, or I can click this translate button and all the information, all the text switches over to Spanish. But my preference is in English, so I'm going to go back. And then we have the PA Care Kit. We have our tagline, personal, practical, and ready for you when you are. And we also infuse, again, that encouraging, supportive language throughout. We have two key buttons here. That's the Take the Understanding Your Needs quiz and Apply for the Caregiver Support button program. So the Take Your Understanding Your Needs quiz, I'll get to that in a little bit, but that's that platform mechanism that I was alluding to. It's our most customized, interactive part of the website. And then the Caregiver Support program, that's the program that we'll be discussing again later. But the point is that the Care Kit is designed to be a product and information, and it's all in one place, but it's also a conduit to all these existing great local programs that we have in the state. And then scrolling down, so one of our motifs is thank you for stepping up to care. Try to acknowledge the caregivers for the hard work that they do. And then all the information on the Care Kit is housed in these three sections. That's the first steps. Where do I get started? It's for a fresh caregiver, someone that's new and doesn't even know where to begin. Or maybe it's a caregiver that's been doing this for a while, but they're offering caregiving for a new level, a higher level of care. They don't really know what to do here. Then there's caregiving resources. So how do I take better care of the person I'm caring for? And self-care resources. How do I take better care of myself? So the first steps, again, it's that hand-holding, it's really supportive. It's everything you need when you're starting the journey. And then caregiving resources and self-care resources are more for when I know what I'm looking for. If I need help on long-term services and supports, or paying for care or legal services, or my physical and mental well-being, that's where I would look. I want to show some other things on the homepage. So we have our caregiving terms and concepts. This is basically our glossary where we have all the terms a caregiver needs to know. It's there, so you can click these letters to scroll down to things, or you can search the page. But if I'm looking for a nursing home, I can click N, and there's a clear, understandable definition of a nursing home. And scroll back over. We also have this Become a Professional Caregiver section. So we have this direct care worker shortage and crisis, and we have all these informal, unpaid caregivers with learned experience and skills in being a caregiver. And we're trying to encourage them or give them maybe the information to turn their caregiving skills into a career. We can illustrate what that looks like and how to go about becoming a professional caregiver. Then again, moving over to the first step section. All right, so we introduced this first 5-step framework. Well, I've designed these 5 steps to be a systematic way to fully assess holistically your caregiving situation. It involves the caregiver more than just about the type of care they're providing. We try to keep them empowered and involved throughout. So step 1, understanding your role. Before you begin, take time to reflect on your role as a caregiver. Step 2, gather information. Being informed will empower you to make decisions with confidence. Step 3, strengthen the support system. Caregiving is not a solo journey. Build a team to help. Step 4, make a plan. Planning reduces stress and ensures no detail is overlooked, especially in an emergency. And step 5, take care of yourself. Caregiving is hard work, and your health and well-being matters. So this first 5-step framework is utilized throughout. We have a number of caregiving resource guides, and we also have our custom guide as well. So first, I'll talk about our general caregiving guide. This is made for any caregiver. It looks like a booklet, and it's printable. It was also designed by our digital director, Angie Bixler. Boy, that's not showing up. But what we have here is a booklet. We introduce our stepping up to care. I like to call this the what to expect when you're expecting a caregiver. Really, it acknowledges that every caregiving journey is unique, but outlines some of the key milestones that you might experience as a caregiver. And again, it's infused with that supportive, empowering language. And then we have our steps. With each step, there's a number of bullets that ask thought-provoking questions that are designed to facilitate critical thinking about your care situation. We have notes here so people can jot down their thoughts and keep information collected. But for example, we ask for understanding your role. We ask people what kind of support the person they're caring for needs, what type of support they're already providing. Ask them to think about how responsibilities might evolve over time, how they feel about the role, what motivated them to take on this responsibility, how caregiving has changed the relationship, what feels most challenging, what feels most rewarding, and how caregiving affects their personal goals. Again, we're trying to help the caregiver think about themselves in the situation too, knowing that it's a dyadic dynamic. It's not just the care recipient, it's the caregiver too. And they need to be involved in the decision making as well. It also helps them think more what they may be getting themselves into. So then step 2, gathering information. This is more about the specific care situation and care task provision. So what does the person you're caring for value most at this stage in their life? How can you best support their emotional and physical well-being? Are you communicating openly with the person? What information do you need to improve care? What health conditions are you providing for? What medications does the person you're caring for take? What benefits or financial aid might be available? And what tools and technology can assist you in caregiving? And then we have strengthened the support system. So who can offer help? What kind of help can they offer? When? And who's, besides those specific care tasks for the care recipient, who's offering you emotional support? What information do you need from health providers? And then, preparing that list ahead of time. Are you communicating openly with your support system? What community or professional resources are available, and what organizations can offer support? So in every care guide, resource guide, we highlight the PA link here. That's a 1-800 number where anyone can call. They speak to a real person, and they can be referred to aging and disability resources in their community. Then step 4, make a plan. So we're trying to get people to think more prospectively about the care situation and care needs. So what does a typical day look like? How can you make those activities more efficient? What are that person you're caring for's long-term care needs? When are the next medical appointments? How do you prevent accidents in their home? How will the person you are caring for be supported in an emergency, or if you're unavailable? And then what are their wishes for care in the future? So those long-term medical and end-of-life decisions. And then step 5, again, recentering the caregiver. How do you manage stress? How are you taking care of yourself? Are you sleeping well, taking time? What do you need to feel balanced? And that balance is a key word we heard from the surveys and from the people we spoke to. They don't always articulate their need for sleep or nutrition, but balance is a way that people articulated, feeling supported. Do you know where to look for additional help? So we're trying to encourage people to look into caregiver support groups or respite programs. And then this last question I always like to highlight: are you celebrating your successes? So often as caregivers, we focus on what we do wrong, what we have not done. When we learn new information, we think about what we've been doing wrong the whole time, but rarely do we celebrate the successes and acknowledge all the ways that we've improved the quality of life of the person we're caring for. So we're trying to get people to recognize and reward themselves for the hard work that they're doing. And then every resource guide, I like these 5 resources for caregivers. That's our local area agency on aging, our AAA, our adult day center, our senior community center. Again, we highlight the P link again, and the caregiver support program. We also include the helpful printables that are on the caregiving resources, which I'll go through in more depth a little later on. And then there's just the back of the page. So again, we highlight our printables here one more time. And then we move from that general resource guide to something that's a little more tailored. So we recognize that there's a lot of common caregiving scenarios and stories that people may be able to resonate with. So we developed 9 caregiving archetypes for people, again, to offer a little more tailored support. So it's not just that general guide. But we have our spousal care guide, caregiver, so that's anyone that's caring for their spouse or partner. The long distance caregiver, someone that's providing care from afar. The parent caregiver, That's an older adult, caring for an adult child or a grown child with a disability. The working caregiver, balancing our caregiving responsibilities with our career. The solo caregiver, someone without that traditional family support system. The sandwich caregiver, someone that's caring for a child as well as their parent. The dementia caregiver, we highlight this specific condition because it's more common among older adults and it comes with additional considerations and expectations for the caregiver. The youth caregiver, that's someone in their 20s, teens, or even younger, that's providing care for an older adult, or maybe supporting their parent that is the primary caregiver. And then we have our grand family caregiver, that's an older adult caring for a grandchild. Usually the biological parent is not involved in the care situation. You can click down on any of these. I'll click the parent caregiver for this instance. We have our definition. We highlight a vignette, and then I'm just going to click right to the resource guide. Again, it follows that same template, that same framework, but instead of that stepping up to care introduction, we include this vignette. And the vignette is designed to be a story that helps people resonate with this situation and highlight common challenges and solutions to this type of archetypical caregiver. So we have Joe and Eric here. Joe is caring for his adult son, Eric, who has Down syndrome. Each of these vignettes highlights the challenges for the care recipient, challenges for the caregiver, and then it switches over to where the caregiver, the PA Care Kit offers solutions. What are the pages that you can click to? What are the resources in your community that you can find? Or what are the worksheets that we want to direct you to? And then again, it follows those first 5 steps. A lot of the questions are the same, but then we tailor some of the questions. So in this one, on step 2, we highlight this question: do you know where your child's important documents are? Knowing that keeping track and being organized helps get that parental caregiving. How can you promote your child's independence or independence for your child? Again, making sure we're involving people in the care decisions, including them in their care and making them feel empowered and independent. So again, we highlight all of those same steps, just a little bit of a tweak. And then still the same resources, the same printables, and those are our vignettes. So we have our general, we have our tailored, and then we have something that's much more customized, and that's our understanding your needs quiz. I'm gonna click over here. I don't know if people are familiar with BuzzFeed quizzes, but basically it takes us through. You answer questions about your care situation, and then the result is this generated guide that's emailed directly to you. It has information based on your exact situation and your personalized needs. We're trying to make state government more person-centered, more customized, and this is how we're doing that with the Care Kit. So the questions, how often it follows the same 5 steps. I know I keep repeating that, but that's important. We try to keep this framework throughout all those different resource guides. But how often are you providing care? Who are you caring for? How long have you been providing care? So what types of health and wellness care do you provide? And then this is on the support system. So do you regularly receive help? Are you comfortable asking for help? We know that caregivers often either they don't feel like if they ask help that people will do it the right way, or they feel sort of embarrassed or ashamed or guilty to even ask for help. So we're trying to help get people more aware of asking for help. So how has caregiving affected your relationships? And that includes yourself as well as others. What concerns you have for long-term care? What about the housing situation, transportation and mobility, social participation and inclusion, financial and legal concerns? And then what about in a crisis situation? So that could be a hospitalization, an emergency, or when you can no longer be the caregiver, when you're reaching that point of burnout. And then do you know where to look for additional help? How often do you feel overwhelmed as a caregiver? How's your physical well-being and your emotional and mental well-being? And I click next, and then I get to the review page. I can change any of my answers, make sure I answered everything fully. I add my name and email address here. And then I click submit. But there you go. We received your submission. You'll receive an email with your personalized get started guide. And then my email just came through. Open that up so you can see what it looks like. It has our subject, PA Care Kit, your get started guide to caregiving. It comes from a PA.gov email address. So people, it's our resource account, but it more trusted than some randomly generated email. And then it has just a little blurb about the custom guide, acknowledges the caregiving journey, and gives a little bit of instruction. And when you open your PDF, it looks like this. Your Get Started Guide to Caregiving. It has a timestamp so people can keep track of these over time. And then the introduction is about caregiver burden. So when based on how we answer questions, it calculates a burnout score. For this instance, you're experiencing moderate levels of caregiver burden. Even moderate burden can feel overwhelming at times. Follow the first 5 steps below with information for your specific needs. And then again, it has those 5 steps, and each bullet corresponds to how I answered a question on that quiz. And so for this instance, I was caring for a child. So becoming a caregiver can feel like stepping into the unknown. You may not even call yourself a caregiver and feel like what you're doing is just part of your responsibility as a parent. Caring for a child with different challenges can be complicated. It can change the dynamic of your relationship with your spouse and present physical and emotional challenges. But it may also strengthen your bond and present moments of joy and happiness that change you forever. Meet Joe, the parent caregiver, to learn more. So this directs you to that parent archetype as well. So like I said, all of these are custom answers. So when we scroll down to other sections, these links are actually directed to parts of the care kit. So if I click here, I have our chronic condition management page, and then there's our, breathing problems, for instance, was our COPD section. But what we're trying to do is, this quiz is fun in a way. It's easier for people to do when they don't know where to get started, and it helps them digest and navigate the big, vast, comprehensive care kit in a way that's more manageable in more bite sizes, and they can revisit it over time. Again, we highlight links to our worksheets. We highlight sections like asking for help, self-care resources, specific things like financial management. We also highlight, direction to local resources like the senior centers, adult day centers, respite care. Again, it's big and it's interactive, and we think people will have a little bit of fun with it, even though caregiving is really fun. And then it still highlights our same resources for caregivers at the end of the page as well. So back to the first steps, I click that understanding your needs page. We also highlight that understanding your needs quiz button all over the place because we think it's, we're excited about it and we want people to take the quiz. And we think it's a really great resource. But I'm going to go through the caregiving resources now just to highlight some of the subjects we have. There's 12 subjects here, and then beneath there's even subtopics. So we have financial planning and paying for care, chronic condition management, aging and community, products and technology. So there's different types of devices, modifications, and adaptations that help people remain in the home, remain in their community. Safe driving tips, communication tips, one of my favorite subjects, caregiving in a crisis. And again, those different crisis situations like a hospital, a public emergency like a blackout or severe weather, or again, when the caregiver burden has reached a point where you can no longer be a caregiver. Is my screen showing the correct thing? Yeah, okay. Caring for veterans, end of life care. We have legal supports, long-term services and support options. So the different settings and stages or types of care, medication management, and then our printable resources. A little further down, we also have our caregiver video library and the Pennsylvania Library Directory. So that we highlight the Pennsylvania libraries here because it's a place that where people go for information. We're also working with our libraries to do training so librarians can help people navigate this, help people take the quiz. And we're also shipping printed materials like those booklets and worksheets to librarians so they can hand out, people like to have something in their hands that they can read. And that's a community hub where people can get those printed materials. But our caregiver video library highlights, different care tasks, and we collected videos from AARP, UCLA Health, the PA Home Care Association, and the Family Caregiver Alliance. So if I'm looking for pain management, I have videos from AARP. It makes things a little more digestible. People like hearing and seeing information more than just reading it. And it's, you can take smaller, 8-minute sections, even fewer. And we didn't have to spend any money making videos, we just collected them. So that was nice. I'm going to do printed worksheets now. So we have 15 worksheets. They're designed to facilitate specific complicated care tasks. Again, they help with that critical thinking. They make these intimidating care tasks a little less intimidating, more manageable, and they help caregivers feel more confident that they're not missing anything. So we have a worksheet for budgeting, for assessing all the care needs that a person has, for coordinating and dividing caregiving duties among family, friends, or even hired professional caregivers. We have a decision-making worksheet so people can go through and identify their challenges, create solutions, and make informed decisions. So that includes both the care recipient as well as the caregiver and others that might be involved in the decision-making process. We have an emergency preparedness worksheet so people can explore the key steps and needs to make sure they're prepared for an emergency, whether they're there or not, but that they have an emergency plan. That end of life planning and funeral planning worksheet so that we're documenting, it helps you reflect on what you want at the end of your life and what you want for your funeral so you can make arrangements and make decisions ahead of time. Home health hiring, so making sure that the person who's coming into your home is vetted and you've asked the right questions and you feel confident that they will be providing care for the person you love in a way that makes you feel confident and safe. Home safety, so identifying hazards in the home, making corrections, evaluating the different housing options based on needs, preferences, and resources, and making the right decision or informed decision, I should say. Keeping track of important documents. And this in-person visit worksheet is for when you can look for signs in general well-being or signs in the home or thinking and vision. So if you're not there every day, you can keep track of changes. The long-term care worksheet, so you can have thoughtful conversations with, if you're evaluating, a nursing home, a personal care home, or an assisted living facility, and you can compare. Again, it has all the questions you need to ask, so you don't think you're missing anything, and you can more thoughtfully compare those different options. Managing medications and supplements, and then the medical appointment worksheet. Very simple, practical tools people told us that they needed and that they wanted. We also have all of our resource guides here if people want to print those. All right, I'm going to hop over to the self-care resources. We also have this navigation pane here where I'm going to click self-care resources. So we have physical and mental health, self-care, emotional self-care, respite care, and caregiver support groups, as well as working caregivers. We know that working caregivers are very common. There's some entitlements for workers and something people can ask their employers that they may not know they can ask. So I like the physical and mental self-care to demonstrate what these pages look like, since I can't go through each one and I want to leave time for questions. So we have our introduction. We have, steps to avoid burnout. Here's what you need to know about physical and mental health. We have our introduction. We're trying to validate and acknowledge people's feelings and give them an instruction of how they can address and sort of provide that solution. Then we have bullets where there's a simple summary statement like be active. And then there's more instruction of how to actually do that. It's easier said than done for self-care, but we're trying to offer people a way, they don't have to think about and do additional research. It's all on one page. So we have a whole list. We try to make it comprehensive enough where people are actually learning. They feel like they have the information they need, but not so long that no one's going to read it. And then we highlight additional resources like mental health, taking care of yourself from the NIA, the National Institute on Aging, and then caregiver burnout tips from the AARP. Or we want to collect links, if people want to learn more, knowing that not everyone's going to have that time or interest in doing that. All right, so that's our demo. I just have a couple more slides. So the last thing here is I wanted to talk about our key messaging, knowing that raising awareness and targeting and meeting caregivers in the community is going to be really important for this project. So this is our central brand. It's not necessarily how we're communicating. These are some of our talking points, but it's not like the whole message or how we create a commercial to talk to community members. Think of it as our central brand. So it's the PA Care Kit. It's personal, practical, and ready when you are. No two caregiving journeys are the same. One day you're simply helping out. The next you're just holding everything together. The PA Care Kit is a collection of tools, information, and support to help you learn more, plan ahead, or catch your breath. It's here to support your role, your time, and your needs, because caregiving rarely comes with instructions. A place to find answers you didn't know you needed, a place to find resources that make sense, a place that sees you as more than just a caregiver. Support starts with one simple truth: you don't have to do this alone. Thank you for stepping up to care. And again, that's how we're trying to anchor all these different collateral materials and things that we're developing around the care. Okay. And the last page. So I was the lead for this project, but I also worked very closely, like I said, with our digital director, Angie Bixler, to create the platform as well as all those printed materials. And I worked with Meredith Hughes, who's from the University of Pittsburgh, and she's also a National Academies of Medicine Fellow. She really helped with those archetypes, with helping with the content development and review. She's been a sort of a great asset for us to have. But then we also worked with all these other folks that are on the page to help review the content, to help us develop it, make sure that we were doing it appropriately. Maybe they were, helping us get connected to caregivers and older adults, so we could, test some of this information material. And I know that there's time for questions at the end. So I think, do we want to just wait for that time? And I see there's something to shoot at.
How about you?
One question while we're waiting.
Yeah, I was going to say this is a great time for if anyone has any questions.
Yeah, see, Nathan is typing an answer. The question was whether or not there's like one big downloadable resource or whether you have to go into each of the sections. Nathan, I don't know if you want to talk about it for a minute or if I saw you were typing.
It will be easier to explain. So yeah, that's the long URL, and then the short one is that pa.gov/carekit. So we don't at this time have a big PDF of the of the resource, because we heard that's not really practical for people. And there are existing handbooks that are big, and they're the comprehensive sort of thing, and I can share a link to that. But what we were told is that people want to have smaller sections, and then it's also more searchable. But we can, it does sound like you'd be interested in something that's more of a single download, so I can look into that and see if our digital director is interested in designing one of those. Oops.
Okay, well, thank you, Nathan. That was great. Lots of good information and resources. And I'm Maria Smith, and working with Patty Arena, and she asked me to kind of step in and give you a little background. We sort of launched right into the discussion, and just to step back a bit and also tell you about how this came about. Patty and I work a lot on future planning for people with disabilities, and the issue of caregivers and how caregivers are supported through their journey, was a topic that we've been discussing, and it's how to provide resources for caregivers. So we worked with Heather Sublacco, who we've not introduced to you so far, but Heather was really our contact. She has been the executive director for Vintage Senior Services, and we've worked with her, to be honest, a very long time when she was at United Way. And we went to her to talk to her about, how can we best provide information to caregivers about what supports are out there. And so Heather put us in touch with Gabby and Nathan and also Russ, who's representing the local agency, area agency on aging, and I'll have her introduce him. But Heather was instrumental in helping us to be in touch with the primary people, the Department of Aging at the state level, but also locally with our Allegheny County area on aging. And Heather, again, we were remiss, and just if you want to say a few words and hopefully help us to sort of navigate all of the the great information that we're getting so far.
Thank you, Maria, and thank everyone. So as Maria said, we were talking about the multi-sector plan and how do we talk to folks about this 10-year plan, the Aging Our Way plan. And when we met with Gabby and with Nathan, they had explained to us that this PA Care Kit was coming out, and I'll tell you, I have enjoyed this presentation so much so far. It has exceeded my expectations. Nathan and team, great job. I love the way that you've pulled together all the wonderful information that's already out there. My experience with caregivers over these many years is that when somebody does a Google search about caregiving, you get 10,000 hits, and you can't possibly distill all that information. It's so overwhelming. And so I'm sure there will be a lot of questions from the audience. And if there aren't, I have a few myself, but I just wanted to thank you both for being here and making the time. It's really good work. And I really hope that the folks that are listening are enjoying this and are collecting their questions, because as Nathan said, this is supposed to be practical. And so we are going to have some time today to answer these questions, and we might not have all the answers, and that's okay too, because that's part of the journey, is trying to figure out how we can support people who have different needs than what, or even the archetypes. So with that, I think we're going to hold questions for now, but thank you so much for making the time to be here, Pennsylvania Department of Aging staff. We really appreciate it. And Maria, do you want me to turn it over to Russ?
Look, if you would, please, just a little introduction. I know that you are familiar with Russ.
I'm familiar with Russ, but I can't remember his title, so Russ is going to help me because I think he just recently changed positions. But I will say that, the Allegheny County Department of Human Services is a wonderful partner in supporting older adults in Allegheny County and really across the state. We do have the second largest percentage of older adults in the country, and so it's a really important place for aging and learning how to support people who are growing older and their caregivers. And the Area Agency on Aging, Russ has worked there for quite a while, and he's held a lot of different positions there. And I know that he has helped with the different programs that you may or may not be familiar with, like the Options Program and the Caregiver Support Program and different things around care management. And so we're really grateful that Russ could be here today to talk with us about the Caregiver Support Program. Again, this is one example of what's available statewide. And so you're going to hear the Allegheny County perspective on this, but wherever you're listening from in Pennsylvania, these programs are available to you, and you would start with your Area Agency on Aging to get connected. And so, Russ, I'm sorry for not the greatest introduction, but if you will just tell everybody your actual title, and thank you so much for being here too. We really appreciate it.
Oh, sure. Thank you for having me. Okay. Well, Nathan gave a more Pennsylvania Department of Aging perspective. I wanted to give a little bit more of a local Allegheny County input on how we administer the Caregiver Support Program. As I said, my name is Russ Gralzik, and actually I have a symbol for our bureau, and that symbol is that triangle where the care managers have to work with the in-house providers and the Area Agency on Aging. There has to be a lot of collaboration to occur so we can really effectively service our consumers in our county. So we built that symbol in there to represent that collaboration, that there really needs to be that effort made by all three entities to serve our consumers, be it caregivers or consumers, at a high quality level. And what I'm mostly going to talk about is the Caregiver Support Program. I oversee the Options Program and the Caregiver Support Program, but there are a couple other programs as well. There's the Community Health Choices, formerly known as Waiver, and there are also the Life programs that also help people remain in the community and not go into placement. Now, the Caregiver Support Program it's a reimbursement. We are reimbursing individuals who are in the program with caregiving expenses. And I'll go into a little bit of detail what that looks like. But it's supplies and home modifications. We can reimburse a caregiver for those. The ultimate goal of the program is to ease the stress of the caregiver. And we do this by providing care management, respite. We really encourage respite, and resources we are providing to our caregivers on a regular basis. So our goal is to provide assistance to all caregivers. So there's caregivers that are in the Caregiver Support Program, and there's caregivers that are not. But we try to assist both groups of individuals through trainings, support groups. We try to connect in support groups. They may want to explore getting into programs such as Options or Caregiver Support Program or Community Health Choices. We provide resources to seniors in Allegheny County and to caregivers. And there is reimbursement involvement to a caregiver if they actually get into the Caregiver Support Program. No, I think Nathan was talking about this. There's a lot of different type of caregivers. Up in the top right hand corner, you see a spouse caring for his wife. Um, when you think about it, you were caring for somebody that might have some dementia, and the first week, the first month, a little bit challenging. But when you get into months and months, and also years and years, that really gets challenging for a caregiver. So that's kind of our goal is to help that individual on the left caring for his spouse, so that their ultimate goal is not to go into placement. We see a lot of kids caring for their parents, and we also have seen a lot of rise in grandparents caring for grandchildren over the last 5 years. That has really increased, and we try to address those specific grandparents, caregivers. We try to meet their needs as well. So there's a lot of different types of caregivers. Now, in the other programs, like the options program, if you're in the life program or community health choices, we're trying to help that individual. We're trying to help that person that's can't do their activities of daily living. But in the caregiver support program, our goal, our consumer is the caregiver. So we really want to focus on that person on the left-hand side who's caring for that care receiver. We really want to reach out and help them do what they're doing so that they can meet their ultimate goal, which is to have their loved one remain in the community. So the other programs focuses on the consumer. In the caregiver support program, the consumer is the caregiver. Now it differs from county to county. There's 52 AAAs. If this is Pennsylvania, there are 67 counties in Pennsylvania, and there's 52 AAAs. But in Allegheny County, if you want to get into the options program, if you want to get into the caregiver support program, you would call our senior line, and our number's right on the screen. We'll talk to an individual. They'll kind of set you up what you're looking for. They'll talk to you, and they'll get you connected with a care manager. Now, in Allegheny County, we have 3 care management agencies. If somebody lives in the northern part of Allegheny County, that yellow area number 1, that is Wesley Family Services. Area number 2, that blue area, is Lifespan. And area number 3, that green area, is Family Links. So we assign a case, be it an options consumer or a caregiver, based on where they live. And you'll get connected to one of their care management agencies. And you'll see that lady on the right side of the screen. Once you get the referral, we very quickly, within 3 business days, will be calling out, trying to set up a home visit with the consumer and caregiver. And that care manager is going to do something called a caregiver assessment tool. It's kind of similar to what Nathan was going over, but we're going into some really specific details, asking about the caregiver. This is just one of the questions on that caregiver assessment tool. We're doing a deep dive into what the caregiver is experiencing, with the care receiver, what some of their challenges are, and we're trying to really assess who's meeting those needs, what needs are going unmet, and where you are trying to fill in the gaps. So we do that by a caregiver assessment tool. We do this initially, and then we do it every 6 months as individuals change, caregivers' needs change. They may increase, they may decrease, depending on the circumstance. Now, we do a very individualized care plan. Just like Nathan said, no 2 caregivers are on the same journey. Everybody's different. I probably should have said this at the beginning. Even though I oversee all these programs, I was a caregiver for my mom for 6 years. She had pulmonary fibrosis, and during COVID, and she could not get COVID. So I shop for her on a regular basis. I cleaned her house on Sundays, and I brought her her meal, took her to her medical appointments. But each caregiver's journey is very different. So we do a very individualized. We don't do a cookie cutter care plan. one of my coworkers, she's also caring for her mother. She has 6 siblings that help out. So we all have a different journey on how this goes about. We offer a lot of services, reimbursable services, and this is just some of them. We really encourage respite for our caregivers, getting a break. There's also adult day care, adult day services available. There's care management. There's some personal care, personal emergency response systems. Those are the buttons you press and when people fall or are fall risk. There's also supplies. There are a number of things available in the caregiver support program. And how you would get to know that is if somebody gets enrolled in our program and they meet with the care managers. So, what does this look like? So on the person on the left-hand side of your screen, she's at an adult day service. How does this benefit the caregiver? Well, that caregiver, may be working, and so the person that they're caring for can get a bath, can get meals, can get interaction stimulation at an adult day service or at a senior center, and so the caregiver gets a break when this occurs. In that middle slide, there is a ramp, a home modification, an assisted device. Before that, caregiver would have to, almost lift the care receiver up the steps. This ramp is benefiting the caregiver, making it more easy to assist the person they're caring for. And also bathing. Like I said, I care for my mom. That would be a little bit awkward at the bathing area, but we have individuals that come in and do personal care. And if the caregiver is paying for that, they could potentially get reimbursed for that service. So that means that that person is getting bathed on a regular basis. If you have a spouse caring for maybe a husband's a big guy, can't get in and out of the shower. Somebody coming in doing personal care is really going to benefit that caregiver. So this is just just a tip of the arrow of some of the services we offer. And so we do very individualized care plans, and there are a lot of services and supplies and things that are available to caregivers. And one of the big everybody in the caregiver support program is assigned a care manager, and God love these individuals, very caring. They help caregivers, they help consumers go through this process. It can be confusing, it can be overwhelming. There's a lot of things out there. So a care manager is their kind of go-to person that kind of walks them through the program, sees what's available, offers them resources. So our care managers are broken up geographically. So somebody in the North Hills might know something that's occurring in the little town of Perrysville that's going to benefit a caregiver. So they try to give that resource, that information to the caregiver. So the care managers are kind of subject matter experts on programs, resources, and they're really trying to work with the caregivers. They're really trying to work with the consumers, and their care plans change as the needs of the consumer and the caregiver changes as well. So that's always being evaluated and updated as needed. We work very closely with Pennsylvania Department of Aging. All the AAAs do. There is a actual chapter on the Caregiver Support Program under Pennsylvania Department of Aging. So they have a lot of guidelines for us to follow and resources to help. That we want to ensure that the caregivers are being contacted on a regular basis, and the program is being administered in a very effective way. There's some income guidelines. It's based off of the care receiver's household income. Depending on how many people live in the home, that impacts in the amount of money that a household is generating also determines the percentage that the consumer is reimbursed. So some caregivers are reimbursed at 100%. Some are reimbursed at 80%, 40%. But everybody at least is getting care management, even if they're not getting any services involved. There's no cost for that service, but being care managed. I think we talked a lot about. There's a lot of things that are out there. Nathan talked about the PA Care Kit, which looks really helpful. There's a lot of services and programs out there, but I never want to lose that touch of what's involved with being a caregiver. The time involved in caring for somebody. When you're caring for somebody that impacts your work life, your career, you might not take a promotion, you might not take a job out of town because of that. The impact on your finances, that when you're caregiving, like for my mom, I was making sure she had a lot of prepared meals, so she could easily heat those up and get to those. It's all the things that you're doing and not doing. You're doing caregiving, but you're not going on vacations. You're not going to events because you're caregiving, and so that does take a lot of it does take some toll on people, both physically and emotionally. So I don't want to lose that that perspective that there's a lot of things out there. There's a lot of programs and a lot of things, resources, but then there's also that emotional element of caregiving in all that's involved. So I'd feel remiss if I didn't kind of highlight those things. So there's also the options program. Some of our care receivers are in the options program. In the option program, the focus is on the care receiver. The care managers also help consumers transition from the options program and from the caregiver support program. Maybe they need a lot more services, so they do help them get into the community health choices, formerly known as the waiver program, or they'll help them get into the light programs. That's some of the things that they also do. If people want to skip and go directly to the community health choices or the light programs, they can call the Pennsylvania Independent Enrollment Broker at that number listed on the screen, and they can go directly to that program as well. Some of the other things we do in Allegheny County, those are baby bots, and people put cell phones where those spaces are, and they have, we give these out to caregivers and care receivers, especially ones who are dealing with dementia. This helps kind of soothe and calm the care receiver. On the right-hand side of the slide is the cat. We also have dogs available. They purr, they meow, they bark. This kind of really helps some of the care receivers who are, struggling a little bit. This kind of helps the caregiver as well, because care receivers receiving stimulation from that. We do work with our local universities, good places for AAAs to get involved. We work with all our different universities on different projects, be it the Capable program and some other programs. So it's a good way to help caregivers. It's a good way to help consumers in a very cost-effective way, partnering with your local universities. In addition to the Caregiver Support Program, we do try to help all caregivers in Allegheny County, be it from the Powerful Tools Caregiver. This is a 6-week caregiving class that the caregivers have support from people who are attending this, as well as they're receiving some information. We do try to get out a lot of online materials, and we're certainly going to add the PA Care Kit to that. We try to partner with other local groups to help, like with dementia and senior centers, and we try to get people connected to support groups. So we do try to help individuals who are directly in the caregiver support program, but we also try to help caregivers who are not in this program, be it for financial reasons or eligibility reasons, or they just would prefer to do these items instead of getting full formally enrolled in one of the programs. So we try to help all caregivers in Allegheny County. So I would love to hear your questions. That's kind of a brief overview of the Caregiver Support Program from Allegheny County and the Options Program. But he said, definitely would like to hear from you and your questions. And thank you for the opportunity to present these programs to you. Thank you.
So this is Maria again. We do have some questions that are coming up, and the first one is the question is, are most of the resources geared to low-income folks, or can any caretaker benefit? And
Well, you can always get it. You can. There is guidelines, thresholds and guidelines for both the options program and the caregiver support program that affects reimbursements or cost sharing, and that's also true for the community health choices as well. But anybody can be care managed. There is no cost for receiving an assessment and being care managed in the options program or the caregiver support program.
so it's only if someone would want reimbursement. Is that what you're saying? Like the reimbursement for certain things, you have to meet certain eligibility guidelines?
Yes, except for home delivered meals. And those are home delivered meals. There is no cost associated with that service. And senior centers, there's a lot of things that are out and available for individuals.
Okay, and the next question is, can seniors receive care management if they're not in the options program?
They would need to be enrolled in the options program to receive care management. They would be assigned a care manager from either Wesley Family Services or Family Links or Lifespan. They would be connected with a care manager that would work with them. They would go out and do assessments. They would receive quarterly contacts. They would have somebody that they could reach out to, a consumer or caregiver could reach out to, but they would need to be formally enrolled in one of those programs.
Heather, do you want to add to that? I know you.
I was going to say, so to get registered for options in Allegheny County, you would call the senior line.
As part of the enrollment process in the options program, is the information provided prior to enrollment if they are cost-sharing fees associated with their income level? This is a question I've encountered from people who are not eligible for the CHC program.
Both our senior line and the care manager would go over those guidelines and cost share, and they would try to specifically answer that question to a caregiver or a options consumer. And they would very specifically go over the cost share amount, and it depends on the services. So if you're in the options program and you're cost sharing at, let's say, 50%, that would affect if you're getting $100 worth of services or $500 worth of services, how much your cost share would be. So it depends on your cost share amount and the amount of services that you're receiving that comes into place. But those are all covered by the care manager in depth. We make sure those questions are very specifically answered, and that the caregiver or the option consumer is very cognizant of what, how much it would be paying before we took the next steps in moving forward with those services.
And the next question, I think, probably goes back to your answering about care manager helping with this, but it says, are the income thresholds in order to obtain these services, are there income thresholds? And I think you're saying yes, meaning if the caregiver or the elderly person has income over the certain amount, they can't get the service. If so, please let us know which ones fall into this category. And if I understood you correctly, Russ, in the past, it's that reimbursement aspect of if they're a caregiver and asking for reimbursements, that's where the income.
The income comes into play in both the options and the caregiver support program. The caregiver support program is a reimbursement process. So the caregiver is actually expending funds, and they would get reimbursed for that based off their percentage. In the options program, there's a cost share involved, which is a little bit different. So if they had, let's say they had $200 worth of services per month, and they were cost sharing at 10%, they would get a bill for $20 for their cost share. They would receive a monthly bill of $20 for the options program. So just to reiterate, the caregiver support program is a reimbursement. So if they were in a caregiver support program, they were getting reimbursed at 90%, and they had $200 worth of services, they would be reimbursed at $180. If they were in the options program and their care plan was $200 and they were cost sharing at 10%, they would get a bill for that amount.
Hey, someone asked, when is the 6-week virtual caregiving course offered, and how do we sign up?
Right now we're doing those for the, I would call it our senior line, and we can direct them. They can either ask for the caregiver support program for Allegheny County, or the senior line can direct them on how to get registered for those classes right now.
Okay. And so someone asked, what's the reason we bother to register or obtain a care advisor if we know that we're not in the low income category? This issue is coming up.
I would just say you're connected with a care manager. There's all these different programs, all these different resources that are out there. And at least, with a care manager, which there is no cost for that. There's no cost associated with receiving care management services. At least we're able to guide you through these different systems and processes, and then also help to explore the resources that are available out there. You do have somebody you can contact that, we do try to educate. We do try to make sure they're on the cutting edge of knowing all the services that are out there in Allegheny County and Pennsylvania. So they might not be directly receiving services in the program, but they would have that care manager to help them find what is available out in the community.
And I think this sort of follows up. Someone asked, so any senior that is not enrolled in CHC or Life can be enrolled in options and receive care management by calling the senior line.
Sure.
Okay. And someone is asking about respite services available through the option program. If so, are they available in all counties?
I wouldn't know the all county one, but I'll let somebody else jump in on that one. But respite is really, it kind of falls more under the caregiver support program. We're trying to give the caregivers some respite from their caregiving duties. There are things available for people who are options. We do have senior companion. We do have senior centers. We do have adult day services. So we do have a number of things that are available for people looking for those type of, be it interactions or adult day service. They can receive meals, and they can receive personal care, as well as stimulation and interaction.
And the last question is, does the PA Care Kit also point to resources on the county or local level? If not, how do caregivers best access those resources? And how do they best get linked up with a care manager, assuming that comes on the county level?
Yeah, so we're always trying to direct people to the area agencies on aging in their community, those local resources, or the senior community centers, the adult day centers, where they're more connected to the Aging and Disability Resource Network. We also highlight the local resources in a number of areas on the Care Kit. And again, every resource guide has the AAAs as well. So I'll answer that. And again, I see a couple more questions added. So can you enroll in the care management by going directly to the care management agency in your area? I would go to the AAA. They usually have the best information on care management, caregiving services. And then also same thing for the last question there, asking about respite funding. resources in Bucks County, I would go to your Bucks County AAA. They are the local aging experts in every community. So they're going to have the best answers to your questions about services on the local level. And again, just to clarify, because respite can be a little confusing. There's all sorts of types of respite. Respite is just the term for temporary help so that informal caregivers can have a break from their caregiving responsibilities. So that could be, something like an adult day center where you can take someone to a location for the day so you can work or take a break to get your hair done, those types of things. That's a little more for a higher need. There's also senior community centers. People can go there, have a meal. The in-home respite is a little different. That's when a professional caregiver comes into the home to provide respite. That can be more expensive, can be more longer wait lists, more difficult to find, things like that. So we always try to highlight the AAAs, the senior centers and the adult day centers for that respite care.
And I guess I have a question, just in general, given that the many of the caregivers that we might be speaking to today may have, again, be caring for a loved one with a disability who may be on a waiver program. Let's say they're on one of the intellectual disability waiver programs. I guess my question is, in terms of that caregiver who might be caring for that individual who is already on a waiver, and of course it probably as a sports coordinator caring for the person with a disability, is it the case that the caregiver, no matter what their age, I mean, we think of the Department of Aging as primarily, enrolling people 60 and over, but could that caregiver, who's that parent, contact their area agency on aging and ask for help in the care management with a care manager through the Department of Aging?
The Department of Aging's programs are generally for anyone 60 and older, and then for the caregiver support program for someone caring for an adult with a disability, that threshold is 55 and up. So I think if you're 60 plus, the first place to start is an area agency on aging, because they'll do the full assessment, holistic, understanding of what your needs are and what they can do to provide you services. But the actual waiver programs are in the Department of Human Services and the Office of Developmental Programs, so we're a little disconnected from them. But again, usually they'll connect you to, if you're an older adult caring for someone, go to the AAA. Or if you're someone caring for an older adult, go to the AAA.
Yeah. So if I understand, if someone is caring for a loved one with a disability and your caregiver need help, if you are 55 and over, you would go to the Department of Aging and ask for that. Am I understanding it? Yeah.
It can be a little weird with numbers because Medicaid 65, we're 60, and then some programs are 55 or 50. But I would say that's the best place to start because they know other resources, even if you don't qualify for the AAA's programs, they'll be able to take you, direct you to places to go.
So it's safe to say that the Department of Aging and their local AAA is a great resource for a caregiver, no matter what, in terms of, regardless if your loved one is receiving waiver services or not. As a caregiver, you have resources, and I think that's what you're. And actually, the toolkit's available to whomever. I mean, yeah. Thank you.
Publicly available, free, doesn't cost a thing. It's information, supports, and direction, right? Really.
Yeah. Thank you. Heather, usurping your time, but.
No, Maria, you're doing a great job and you're asking all the right questions. I mean, I think that was the one thing I was going to say is just that PA Care Kit, the hole that it fills, like I was saying earlier, is not that it's going to tell you that you qualify for the caregiver support program necessarily. It's going to help you as a caregiver get organized about what you need and where you need to go. And then again, I really hope that it's a no wrong door where you're going to call your local area agency on aging. And if that's not quite the right place to go, they're going to be able to tell you where to go. We all know that none of this is perfect, but I would just encourage you to not give up, because if you don't get quite the answer you're looking for the first time you call the area agency on aging, then maybe you call back a second time. Don't love that answer, but just in the spirit of practical and realistic, it's important, to use that care kit to get yourself organized so that you know what questions to ask. I think the better questions that you ask, the better information you're going to get. And so that's where the care kit really feels to me like an important tool for you to know. I really need help with these three things. And so when you call the area agency on aging, you're going to say, I'm really looking for these 3 things. And that should really help guide the conversation. I think sometimes when you call the senior line and you don't have a really good idea of what you're looking for, that can be a really hard thing. It takes a lot longer to navigate. And you also have to be prepared to share some information about your income and your needs. I mean, those are some other things that they can give you some general information, but to really drill down, you have to be willing to share some of that information about your financial situation or that of the person that you're caring for.
I couldn't have said it better myself, Heather. We're trying to make a whole spectrum of services, all the way from just information to that more supportive care management. I also want to highlight one more thing, just because you mentioned it, sort of. With the caregiver, with the development of the care kit, we also have this parallel project to refresh the PA link. So we're undergoing a strategic planning process now. But again, I mentioned that the 1-800 number you can call, you talk to a real person, they'll get you connected to your local resources. So then you don't have to have the question of which AAA is mine, which county office do I need to call. You call the PA link, they'll direct you to where you need to go regardless. Or if you're caring for, I'm in Philadelphia County, my parents are in Allegheny County and I need support there, they'll help me make that distinction as well.
I do have another question. Are the caregiver support programs in Pennsylvania, is that totally state funded, or are there some federal funds there?
Yeah. So Pennsylvania's older adult programs are supported by the PA lottery dollars. So that's something that's unique to Pennsylvania. Gabby can answer this better if there's federal Older Americans Act funding.
Yeah, there is Older Americans Act funding that is involved with a lot of our caregiver support programs. And then there is a state match that meets half, usually about 50% of those dollars as well.
Not Medicaid dollars. It's Older Americans Act. Okay.
Yeah.
Thank you.
And the Pennsylvania's Caregiver Support Program is sort of the national model. They sort of created that national caregiver support program based on what we developed here.
Super.
Always like to highlight that.
Very needed. Very needed. I'm sure a number of the people on this webinar today can attest to the difficulties of being a caregiver and how trying to navigate all of the resources and figure out how to survive on a day-to-day basis sometimes can be a real challenge. So,
and I just saw one other question come through, and I think we should clarify, because it sounds as though maybe we made it sound that you could get a waiver and a AAA program. And your anonymous attendee, you are correct. You cannot get both those things. So if you're getting a Medicaid waiver, then you would not get options or caregiver support program. You could choose to do one of those instead, but you were correct. You cannot get both things. But it's just another good reason to call and see what the options are for things besides, if you're already on a waiver. It's really you're going to get the most support usually when you're on a waiver. But there may be other things that could help you, again, looking through the care kit, et cetera, to support the journey in addition, even if it's not options or the caregiver support program.
But I'm sorry, but if my son or daughter is on an ID waiver, intellectual disability waiver, I'm elderly, I'm over 60. As a caregiver, I'm not being paid by the waiver, but I'm needing help. Can I access a caregiver support program?
Well, do you need help for your personal care or for, yes. So sorry. So this person made it sound like the same individual they were asking, can the same individual get both? But I guess you're right, Maria. As a 70-year-old who needs help with my activities of daily living, I could go to Area Agency on Aging and get help while my son was also on a Medicaid waiver. Gabby, I'm right?
Yeah, that's kind of where
Recipient services can get one or the other. But, in the same family, there could be multiple things happening.
Yeah. Thank you. Yeah, that's what I was kind of thinking, because that might, assist some of the caregivers that we're aware of that, are older and great. Lots of super information, great information.
Yeah, thank you all so much. And that really helped us bring all this together today. And it feels like forever when we started talking about this, but we really appreciate you helping us navigate this topic. We've never done anything like this before, and really appreciate you introducing us to Russ and Gabby and Nathan. And to Russ, thank you so much for filling in at the last minute. You did a fantastic job. All of you did. And there was so much good information.